A very good evening to all of you. And I know this is the last session, and coming in after such a vibrant and such an animated dialogue sets the bar too high. But Ms. Bedi, let me assure you, we will not lose, and we will try our best to make this a more animated one. And we will make sure that somebody in this room foots our bill. So when I saw the topic and I was when I was discussing this topic with Sangita and Dr. Trehan and Dr. Wanda, I said, let's change this a little. Let's change this to who foots the bill, and with your permission, Mr. Majal, how do we change the size of this bill? So it's no longer about the growing size of the bill, but fundamentally restructuring what this spend should look like. And I thought, given this august audience that we have here, really stalwarts of our healthcare industry, let me pose some very pointed questions to them on a few topics. And one topic, which is the question itself, Sangita, for you is, how do you change the size of the check itself? It's not about footing the bill, but changing the size of the check itself.
I'm glad you're starting out with truly the right question. At 1.3% of the budget of government spending, or 5% of GDP for the overall healthcare budget, this is truly not enough for a country of our size and with the current profile of disease patterns. I can give you a bunch of statistics about inadequacy of number of doctors, number of beds, number of nurses, but I'll bring one statistic which is closer to home. Of the 38 million diabetics who live in urban areas, and you know the rural environment is worse, 38 million people, can you guess how many of them are having appropriate diabetes care? It's less than 3 million. And the outcome of neglected diabetes is a whole nother chapter. So the basic fact is that Amit started off the session with the right question. We need to increase the spending, and the other fact is that compared to any other developing country, the previous session or one prior with Rupa and the others, you're talking about being part of a BRICS country. We are the BRICS country with the least allocation of GDP spend. However, yesterday I was actually in a session where they were saying that as the GDP grows, and if we increase the budgetary allocation, right now, with 1% government spend, 4% out-of-pocket spend, and approximately 5% of GDP. With the GDP at $1,000, this overall number is inadequate. And that's why your primary healthcare centers are not manned, your IMR and MMR mortalities are so high. There's a series of stuff. So we need more money, number one. We also need to change the fact that this is coming out of private spending. We need government spending to be a lot more, because out-of-pocket spending or healthcare expenditure is the number one cause of rural indebtedness and the number two cause of urban indebtedness. So it is completely unfair. So I can just say that we need to increase the size of the allocation, we need to change where it's coming from, and of course we have to improve the efficiency with which it's spent.
Absolutely, Sangita. And let me add one more complexity to it, which is, as a patient for myself, it's not about me going to the hospital, spending that amount there and walking out. It's about understanding more and more of how much I'm going to spend on during my life on my condition. And to that, Dr. Trehan, I'd like to get your views. How would the healthcare system give more comfort, and how does the patient needs to change their behavior to understand what's the bill going to be and how they need to manage it by themselves, because it's a lot about their own responsibility?
See, I think it's very nice to talk about the end products, but you cannot do that without rewinding to the basics. So like was said already, that the actual size of the budget is low and public is bearing the burden of a large part of it. Okay. But behind that is the fact that as we want to move forward and actually affect the delivery system in a way that it covers the last man standing on the ground in India. Okay. One, we know the government doesn't have any money, at least they pretend they don't. So the question is, you're not getting any more money. But you need to use your brains. We have a very large, of course inadequate, but large facility asset on the ground, which is not performing maybe at the highest end in the private sector. 65% occupancy is the common things. There are some institutions which will bump up to 85, 90%. But you're saying in the private sector, there is idle capacity. And then people are being accused that to make their systems work and affect their bottom line, they're doing unnecessary procedures. Well, part of it is true, and that is a sad part of it. And on the other hand, if you look at the government assets on the ground, some of them are overburdened hugely, and some of them are not utilized at all. So if you have an asset on the ground, first attitude we must change is whether it belongs to me or it belongs to government, it belongs to India first. It belongs to the people of India, and if we are abusing them and pushing them below poverty line by our acts of omission or commission, I think it's a crime, because health is a fundamental right of every human being. So now we go forward to say there is no government in the world who has been able to give free health care to their people. We have, you take America with $2.3 trillion a year, 350 million do not have, 50 million are out of the net. You're talking about 1.2 billion or however billion we are, and we are spending maybe 1/100th of that amount, and you expect that to have any effect. It's not happening. So let's not even go down that debate. The debate is, in my mind, why are we working in silos? Why do we have thick firewalls between the government, the private sector, and the NGO sector? If we were to break them down, first let's make the effort to utilize those services in tandem, and you can get 50% more bang for the buck today as we stand, just by somebody using their brains, changing their attitude, and making an effort. I am sorry to say, I don't think anybody cares. I think we talk about it, and we are criminals for sitting on panels and expounding all this nonsense every day after day after day. I've been on maybe 100 of them, but how much change have we made, or how much has government given in, or how much has private sector given in? It's all talk. So I think if we want to do what we were talking about, let us try to get as much as we can get done. The government can be a buyer of healthcare from private sector at reasonable rates. It is on the table. Why should somebody die from heart disease or cancer or any other disease today if that facility can be made available at half the price to the disenfranchised by private sector also, provided the government pays their bills? We have many, many problems with it. So when you talk about your responsibility or my responsibility, we are not the issue. We will manage. The issue is the larger healthcare system of the country, where if we think about it, I'll give you a very simple 3-line formula: decrease the disease burden by providing civic amenities to every village and rural cluster which is in trouble. 2, align the services across all segments of whether private, government, or this, and let he do what he does best. So the government does the primary healthcare and secondary healthcare. Where there is deficiency, private sector will participate with them to resurrect it and make it perform for the people on the ground. And if tertiary care is created, if it's lacking in the government, because there are 6 AIMs standing around the country which do not have any staff to perform. So we have spent hundreds of crores, but they are not performing. So if there is next to that AIM, there is an Apollo or a Max or a whatever hospital that may be, which has the capacity, let them serve the people at almost at cost, even below cost. But even below cost, you must pay your bills, because then everybody stops accepting these programs because the bills are not paid. So I think if these 2-3 things can be done, we can have a different dialogue next year when we sit here. Sorry for not answering the question, but I think that is a very small part of life.
So let me push that one more point to you, to the point you made, Dr. Trehan. So if you had a certain allocation, whether it's 5,000, 10,000, 40,000 crores, what would be your top 3 areas of spend were you running the health ministry?
Okay, as I told you, first thing I would provide civic amenities to every village that we can progressively over a period of time. By the way, we are sitting on the hero Mindmine, Mr. Sunil Munjal, and we have done the pilot projects where you can actually transform a village with 5 things, that is sanitation, garbage disposal, mosquito control, clean drinking water, and a school for 12 lakhs of rupees. We have repeated it again and again. When you go to the government and say, we can do this, they say, well, they're asking us for 1.5 crore for each village. So that's their own mechanism. So you're saying that we will not be able to, that 40 crores, 40,000 crores, if it's done, and I'll give you the solution right here, for 18,000 crores. We made a proposal to the government that increase the RSBY, that is 30,000, to 60,000. That will enable every citizen below the poverty line to access healthcare at any facility. Any secondary care, whether it's gallbladder or whether it's appendix or there is tumor somewhere, you can get a surgery done for less than 60,000 rupees in the fanciest of private hospitals, by the way, okay? Second, cover each family of 5 with a 2 lakh catastrophe illness cover per year. This is now covering 72% people who are not in the loop, okay? It'll cost a total of 18,000 crores a year to cover this insurance. 9,000 crores can be collected from people who are above poverty line but below a certain middle class line, 100 rupees a month. So if you're making a salary of 10,000 rupees, you could afford to cover your family by 100 rupees a month. So 9,000 crores will come from that. 9,000 crores will come from the BPL. So what happened in the budget? We also had proposed that to prevent people from getting sick, maybe you should increase their preventive health check or insurance from 15 to 30,000. It was moved from 15 to 25,000. The people who didn't need it got it. The people who didn't needed it the most didn't get a penny right now. So nothing has changed with RSBY, nothing has changed with anything. So what I'm saying is, who cares? When you're talking about that, so 40,000 crores is too many. You give me 18,000 crores, at least I'll implement this per year, with 9,000 crores saved for the next year. So there are solutions, and I know Sangita and we've all been working together of making proposal after proposal to the government saying the private sector is very willing to give the BPL patients at cost or even slightly below cost, because we can cross-subsidize it. But the only precondition is we are willing to do the service, but we cannot do it on money which is not paid to us, so that we are in debt to the banks and paying 12, 14, 15% interest. If you break that cycle, I'll tell you overnight things can change, and we are all willing to participate. If you disagree, you please say so, but I think I'm speaking for you also, right? Okay?
So Dr. Wonder.
What I'm saying, sorry, if I'm sounding angry, I am very angry.
So I think that while I agree with most of what Dr. Trehan said, I think I also would like to state that there are things where the private health sector would, of course, definitely angry because we haven't got the output for the effort that we've put in. But I think it's very important to recognize that it's not just the healthcare providers, but the healthcare providers and the pharmaceutical industry together are creating a system where we're offering these services, high quality services, at 10% of global prices. And when we were discussing, why is there not an outrage about this? There was an outrage about water. There was no clean drinking water, and mineral water is born. There's an outrage about lack of power, and people found an alternate mechanism of generators. So a certain class of people are finding their own solutions, but there is a huge area. So I mean, I've toured rural India. We're doing tremendous work in a cluster of villages. We've proved a concept that you can give insurance for 1 rupee a day, and besides water, sanitation, education, early screening, you can then cover advanced healthcare for 450 rupees for a family. These are things we've proved. We've done some of them for 15 years. We've done it in larger clusters. So it pains us to see it not happening. So like he said, we're not getting the output for the effort that we've put in. However, I remain extremely positive that we can find ways to do this. And I think the biggest momentum is really the fact that private self-insurance is gaining huge ground. So one of the tweaks that we need is a regulatory mechanism which says RSPY, or a compulsory universal health coverage across the country, and an option for people in the middle level to take one step further, and to put public and private sector hospitals on the same level. If a person wants to go to a government hospital and get reimbursed through insurance, it'll create an efficiency in the system. Otherwise, there's such a vast diversity in the quality of care. But the one thing that, and all these systems will evolve and take time, and private will play a certain role. The one thing that we cannot afford to neglect or ignore or waste time is the entire issue of infant mortality and maternal mortality. We cannot hold our heads up in any global forum. Our statistics are extremely bad. And we have states in this country who match global numbers, whether it's Kerala or Tamil Nadu. So I don't see why the other states can't do it. And some of the best examples are when they've created public-private partnerships that work. So I would say 60,000 PHCs in this country, so that's 10% of the 6 lakh, find a way to hand them over to 60,000 willing private sector, reimburse exactly the same as what is being spent, use the power of reimbursement and regulation to ensure compliance and quality standards, and create a momentum. And believe me, then the government sector also will start doing a lot better by the comparison of what's happening, which is exactly what's happening in our village. The other PHCs are stepping up because the Chief Minister is saying, why is that one in Chittoor able to do so much? So I think we need to work at the grassroots, work at universal health insurance, work very strongly on preventive healthcare. NCDs is sweeping. It is estimated $6 trillion will be the impact of NCDs in this country by the year 2030, which is 70% of GDP. It's a scary number. We cannot sit here and do nothing. So I request the youth who can, move the world through social media. I request very senior people who are in this audience, and I'm, really privileged to see all of you. Please focus public attention on healthcare. Private providers had tried to play a role and were doing bandage effects on the volume of the magnitude of the problem. So we need that, and that's why the public outcry has not come as large. And the question I think Hero Mindmine beautifully asked is, why are people not focusing enough on healthcare? And thank you for giving us this session, Sunil. The fact is that public need to focus more. And with that focus will come prevention. And again, I think, like Dr. Trehan, I'm equally impassioned, so I'll keep talking about this subject. I must hand over the mic. But I just want to end by saying there's a lot we can do. There are people who are doing it. We need to enhance the scale and the size. And if a person dies of a disease or a problem where medicine or science has a solution, then that is a crime. And that crime is getting repeated every day, so we need to stop it.
Dr. Wanda, I'd like to bring you in because you sit right in a hinterland of a state, Punjab, running an extremely large, one of the largest institutions there, and getting a lot of people, not only from the state, but from Pakistan or Jammu and Kashmir and others, and especially youth. And to the point Sangita mentioned, and I think it's a big issue that we have in front. What has been your experience, given you are catering to a semi-urban rural population in a very large, almost similar private sector facility that you manage? What have been the learnings on how you run it so that the overall bill for the end patient has been more palatable than before?
Well, we are a not-for-profit organization in Ludhiana, and the reason this debate is happening is because Mr. Sunil Munjal is the chief of the institute that we run. It's a 1,500-bedded hospital, the largest hospital north of Delhi, and we perform one of the largest numbers of cardiac procedures their side. But the point that Dr. Trehan raised and what Sangita also said is actually it's something that bothers every administration or management that runs a hospital in terms of how to make cost-effective medical care available to a large population. And that's what seems to be bothering you, what you asked Dr. Trehan and Sangita just now. Well, it's been an issue to us in this institute also because we are a not-for-profit organization, and we have been trying a whole lot of cost-effective models. I would say India as a nation, if you really look at, there is a lot of dichotomy in terms of healthcare. On the one side, we have areas of excellence, which Dr. Trehan runs. They get invited to some of the top institutes in the world to give their discourses on what we do and what procedures. We have medical tourism coming up to this country. And I am told almost 15 to 20% of patients today in Delhi in private hospitals are of medical tourism. But on the other side, what Sangita was alluding to was we have one of the worst health parameters if you look at. The government came out with the Millennium Development Goals that we had, which was started in 95. And I'm sorry to say in all those 4 goals, be it reduction of infant mortality rate, reduction of maternal mortality rate, or reducing infectious diseases, we failed miserably. And we are considered a part of the BRICS nations, but in terms of our health results as a part of BRIC nations is dismal as compared to China or Brazil or South Africa. We fare very poorly in terms of our health parameters because of the very fact, and it's very appropriate that we only have 3 people from the private sector sitting here. You don't have any government sector because we are a unique country where 80% of the outpatient visits are handled by out of pocket from the people's own by the private sector. In no other nation you have a ratio of this kind where almost 67 to 68% of health expenditure is happening through the private sector. Almost 60% of admissions are happening in the private sector. So we truly have a system where the needy, and there is a large divide in our own country. There are some good performing states like Kerala, like Maharashtra, like Punjab, and there are some dismal performing states like Madhya Pradesh, like Odisha, or Uttar Pradesh. And there is a huge difference in terms of health outputs that are reaching to these individuals. Indian models for providing cost-effective healthcare models are there. We have the Arvind Eye Hospital, we have the LV Prasad model, where as physicians, and you can see the anguish on the minds of these 2 gentlemen who have devoted their whole life to medical profession for the simple reason that you feel very helpless. There is a huge number of individuals who comes to you, you want to serve them, but simply for the reasons that they cannot afford, only 5% of individuals who need a cardiac surgery get cardiac surgery in this country. So you can imagine how much is the gross difference in terms of requirement and what we are able to deliver. And in that sense, as Dr. Trehan said, there is a lot of pluralism of services which we have to bridge. The government and the private sector, we have to realize the fact that private sector is the dominant factor in our country. US spends 17% of its GDP on health. Most BRIC countries spend 8 to 10% of their GDP on health. India spends one of the least. We spend 4% of our GDP on health, and out of that 3% comes from the private sector and only 1%. And the latest national health policy which has been drafted this year in 2015 says that we are aspiring to reach 2 to 2.5%. We did this when 15 years back our second national health policy came. We wanted to go up from 1.2% to 2%, but it just did not happen. And that's the reason our health parameters of our country are very bad. And we've been discussing economic growth here since morning. See, what is economic growth for? It's for health and happiness of the individuals. And if you look at the Human Development Index, which is, I would say, a better parameter of happiness or development of a nation as compared to GDP, which most economists would consider. Out of 190 nations, we are figuring at 130. So and we've slipped 20 slots in the last 5 years. And Human Development Index is nothing but health, education, and the gross income. So we really need to, as Dr. Trehan said, pull our socks up, get together, look at this issue in terms of providing cost-effective health to the poorer, to the urban individuals where health does not really reach. And we today have excellence in metropolitans, in Tier 1 cities, but in Tier 2 or Tier 3 cities, that is where probably a hub and spoke pattern, if the government gets in some of these private sector, big groups set up peripheral centers, maybe we are able to cater to a larger population, which is otherwise deprived of healthcare.
Thanks. So I think we've got just a few more minutes, but I'm going to ask one question to both Sangita and Dr. Trehan, and maybe 1 or 2 questions from the audience. Give us one innovative or disruptive idea to cut the check.
See, healthcare is complex and one idea is difficult, but I will share with you one concept. And the concept is that if we can look at the Uberization of healthcare, so create a technology overlay which ensures that people can source and access healthcare where they need it, of a certain quality and standard, from a provider who's willing to give it with a transparent pricing. So if we lay that concept, then the technology will evolve to the point of care testing, using distance, telemedicine, all these factors will evolve, but it needs a certain infrastructure. So it's not a it is a concept of Uberization of the entire healthcare, which I think will be transformational. But I must add that this won't work till we put universal healthcare in terms of insurance and adequate focus on preventive healthcare, because we need to ensure that we see the disease early. And final, again, I can't resist the opportunity, but we must add health into the school and college subjects. Like we learned moral science, we have to learn health and preventive healthcare. We're losing it and we're discovering it too late, that there's a huge lot that the individual can do. So empowerment of the patient is probably the single most, or empowerment of the healthy individual to stay healthy is probably the single most important one.
I think if you want immediate effects, and like we say, if a child dies today for want of healthcare, it's a crime. It's a national shame. What we need to do is to, depending on the size of the hospital that is in private sector, ask them to adopt a proportional size of area. If I have a 1,000-bed hospital, maybe a district or half a district or a quarter of a district, and say, you shall now participate in uplifting the health of this sector. It's your responsibility. The government subsidizes what they do, these are things that we can work out. But from immediate effect, if Apollo has 20 hospitals, you can say you can cover, no, I'm just saying, for instance, no, I didn't want to advertise, no? I don't, that's why I didn't mention the name Medanta, because I don't want to. So that's it. I think from tomorrow, if the government decided, line up all the private sector hospitals and say, come in and tell us, what can you adopt? We will give you whatever services on the ground because they have the administration. I think in very short order, we shall be able to help and be proud of uplifting the health of our country. I think it is possible. I think there is goodwill, because we sit from our different committees like CII Committee on Health. We have 8,000 members. The Association of Hospital has 10,000 members. So we have a huge network that is receptive, and I think that we can leverage it. And we've been saying it again and again and again. I wish somebody would listen.
So I think we have time for just a couple of questions, and I would request if we can keep them crisp. Yes.
Question for both Dr. Trehan and Sangita Reddy, because they are related. Dr. Trehan, you mentioned a very good model which you have along with Mr. Munjal. And as a result of your 12 lakh investment, if you can briefly tell us the impact of this scheme on the number of diseases coming down. Secondly, Sangita ji came out with a model where for 1 rupee a day, all kind of healthcare is possible. If it is independent of the government, it looks like a good business model. So what stops you from, if government is not involved, why can't you make it an all-India scheme yourself? You have enough private sector experience. And why can't Dr. Trehan adopt your business model also? Because he feels very angry and frustrated with the government, rightly so. But maybe keeping the government out, you yourself, between the two of you, you can create a good model.
And he's saying you do it if the government is not.
I'm sorry, I couldn't quite understand the question.
He's saying if this model is viable, what is stopping you all from going ahead and doing
No,
this?
you need, see, the district administration runs, or the state runs their own healthcare facilities. Every block, every village, every 5 villages is supposed to have either a PHC or a sub-center. You have to hand them over to us and say, whatever the budget was allocated for those places by the government, we shall run them along with the government.
Success of your 12 lakh model.
The model which you have evolved,
Oh, okay. I told
how much impact it had?
So, Daruheda is the village which is in Haryana, abutting the back wall of the Hero plant. So we first did a study on that to say what was the state of sanitation, garbage disposal, and I'll be very happy to give you the presentation. It's a visual. I can send it to you on your email. You should see the before and after effect. So what happened? We built an open sewage system connecting all the homes into septic pit.
All that, doctor, what was the impact?
I'm telling you, okay.
Did the disease come down?
All right. So there was a 70% reduction in communicable diseases in 1 year.
That's what I want.
The school, which was defunct because there were no toilets and girls won't go to the school because the boys chased them in the bush, we just had to put 2 toilets and the school was back in action in 4 months. And you could see the whole transformation. Now, what is the disappointing fact is that we trained the villagers to maintain it. And we found that they were actually not doing it. They just took it as a sop for them, like they are used to from their whole life, and that we would have to intervene to maintain it also for them. So, if every plant that exists in an industrial group adopted 10, 15, 20 villages on the model, you could change it, and there are many who have done it now, started doing it. And now you know that we have started the skills program, the Health Sector Skill Council, that we are also multiplying it that way. But this program is alive. We can give you all the demonstration, and anybody who's interested in implementing it will be very happy to assist them.
Thank you. I think I need to stop here.
Okay, I'll try and be brief, but it is a comprehensive program. The 1 rupee a day scheme is the insurance reimbursement for advanced healthcare. We realized that primary healthcare was uncovered. We started the screening programs. We now have a cluster of 17 villages. In fact, one entire mandal we've recently taken over. 100% screening of cancer, and brought down the incidence of cervical cancer in the country. And the biggest question, I think, is that till date, this was a CSR type program. We've just got the PHC from the government as well as 11 sub-centers, but we will share the data. I think that to look at primary healthcare in its entirety. I'm not talking about one small clinic. Primary healthcare with genuine preventive healthcare is not a commercially viable model. It needs to be funded. But what we do bring is energy, monitoring, and efficiency into every paisa that can be spent, and that's really the model to be pursued.
I'll just add one more example, and this is someone who's an ex-colleague of mine who set up 12 primary healthcare centers in Dharavi. And for 50 rupees, they provide for consultation plus paracetamol, 75 rupees consultation plus antibiotics. But you know, as you said,
but the income level of Dharavi is very different from rural India.
That's true.
So that's the.
But you know, at the same time, Sangita, to your point, even they are not.
Thing to do.
They're not being able to run the model without sharing the infrastructure. Correct. So a large part of their cost is something which is shared cost. So you have to figure out a way.
You have to figure that
because
out.
Otherwise, it's not economically viable.
And the best way is really to take the captive infrastructure and the current allocation from the government, enhance the efficiency of that, and create a top-up, because villagers are willing to pay. They just want genuine service. So if you do a combination of these three, you can create a replicable model. We're beginning to do it. Next year, I'll have a far more improved story to say, because we've started some genuine partnerships with the government.
And there is, you can supplement it with mobile healthcare, which is one tenth the cost actually, and you can cover 4 times the ground.
And
see, now the ideas are coming out.
So it's mobile healthcare as well as phone-based, that mobile healthcare. And when you put both together, you get one more scale efficiency factor. And all these are being put into the model, as well as a personal health record and empowerment through education to the villager, and yoga and meditation. So we're doing the whole piece.
So on this holistic note, let me thank the panelists, and I'm sure they're available for more questions, but it was lovely to interact with all of you. And can I have a big hand of applause for all of them?
A very healthy discussion about the healthcare in India. Ladies and gentlemen, let's have a big round of applause, please. It's our final session for the day, and of course, it was lovely to have all of you join us. I'd like to request Mr. M.S. Unikrishnan, Managing Director, Thermax India, to please join us on stage to present the mementos to our respected panelists. Present a memento to Dr. Naresh Trehan. Present memento to Miss Sangita Reddy. Dr. Gurpreet Singh Wander. And Mr. Amit Mookim. And ladies and gentlemen, thank you so much for joining us on day 1 of the Mindmine Summit 2015.